My name is Mary Shearer, and I work with the Transplant Surgery Department. I am from Charleston, South Carolina. I grew up there, and I have been living here in the Midlands for the last couple, 2-3 years. And I did my studies down at the Medical University of South Carolina, became a nurse practitioner through the MUSC group, and have been working with them for some years now. So I work with transplant surgery, and our main goal is to have folks that need a kidney transplanted. So I take care of folks who are going to need a transplant on more of like the evaluation side of things. And then I'll see folks after they have their transplant. So within transplant surgery, my clinic is in Lexington, South Carolina. And what I'll be doing is evaluating patients that need or would like a kidney transplant. And what happens from there is typically our group in Greenville, which is where the surgeries are done and where the main team is, will be evaluated as well. And as a group, we'll decide about if you're a transplant candidate. And then once you're having your transplant there in Greenville, if you live here in the Midlands, I may be able to see you again back in clinic for your post-operative care, post-kidney transplant care. My real interest in school and coming through nursing before I became a nurse practitioner was in kidney care and diabetes care. And so that kind of led to transplant. And I would say I've been with transplant now since about 2008 in different roles. And I've stayed because I see the way that a transplant can affect someone's life. The quality of life that improves after a transplant, and just seeing someone's change in their view of life. Now they can go and do things that they've always wanted to do, and my ability to help them do those things safely and with a good plan for their transplant is why I've stuck with it and plan to continue to. Wow, I think education and inspiration is something that I've seen most folks after transplant seek out from me. And so it's been an easy thing for me because they want to know how to take care of their transplant. And I'm just the person that can answer the questions and have that dialogue with the folks who've had their transplants. Usually they'll bring the questions to me, and I'll be able to just give a simple answer. And as we get to know each other over visits, I think that's where you really build the trust and the ability to share things and build on what you've shared before. And that's just the long-term way that we all learn, right? It's building on the simple foundation, and you get a more complex foundation. But I think that's my goal, is to have a long-term relationship with patients, that trust that you can build over time. And that's really where you're able to share what you really think is important to take care of that transplant. Outside of medicine, I have a lot of interest. Dogs. I have 3 beautiful dogs that keep me busy. I love doing water sports like kayaking and paddleboarding, swimming. I love bread. I love baking and cooking. To make an appointment with me, please ask your nephrologist to make that referral.